everyone. We would like to thank all our colleagues and partners in public service and dignified guests who are here with us today. Welcome to the fourth the Biennial Conference led by the University of the Philippines through the Padayon Public Service Office of the Vice President for Public Affairs. The CUPSCon fosters presentations of best practices and innovative ways of higher education institutions in connecting and forging partnerships with different sector, communities, and civil society for the delivery of effective public service. The ongoing pandemic alters the design of the CUPSCon and limits our interactions. But as we will see in this two-day conference, the impact of the discussions that will take place are as strong or even stronger and more relevant. A few notes before we start. The keynote and plenary sessions are now being live streamed in YouTube and Facebook. Please visit the chat box regularly as we will be posting links and announcements there. Please observe proper video conference etiquette at all times. Kindly refer to the interactive Book of Abstracts for more comprehensive information about the conference and the panel sessions. We will now begin the CUPSCon 4 with the singing of the Philippine National Anthem.
Bayang mabiliw, pelas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiging, sa manlulupi, di ka pasisingin. Sa dagat at bundok, sa simoy at sa langit mong butaw, may nilagang tula at awit sa paglayang minamahal. Ang kislat ng matawad mo'y tagumpay na nagtitinig. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng walhati pagsinta, buhay ay langit sa piling mo. Aming ligaya na pag may mga api, ang mga
And now, to deliver the welcome remarks for a pivotal moment in the history of the CUPSCon, please join me in calling on the Vice President for Public Affairs of the University of the Philippines, Dr. Elena E. Pernia.
Hello and good morning. Dr. Gerardo D. Legaspi, the Director of the UP Philippine General Hospital, Ms. Ana Patricia Patreng Non, Founder of the Maginhawa Community Pantry, Dr. Raul Destura, Deputy Executive Director of the UP Philippine Genome Center, Honorable Marcelino Marci Teodoro, Mayor of the City of Marikina, and our very distinguished participants, our friends from all over the Philippines. I see on the chat box that we have participants here from various universities in Metro Manila, in Luzon, in Visayas, and Mindanao. On behalf of the University of the Philippines, I bid you welcome and good morning. Magandang umaga po, maayong buntag. Almost right on the dot, we meet again for our fourth Colleges and Universities Public Service Conference, or CUPSCon, which is a platform for scholarly presentation and discussion of extension and public service initiatives. Held every 2 years, CUPSCon was last held about 2 years ago in Iloilo at UP Iloilo. That was during the pre-COVID-19, when gatherings such as this were still possible face-to-face. Between then and now, our world has changed. The disruptor that is COVID-19 created havoc in the whole world. In the past 18 months, since the start of the pandemic and the consequent community quarantine levels, we, the Filipino people, have gone through various emotions of fear, anger, loss, compassion, and hope. I'd like to show you a graph of a year's worth of emotions related to COVID-19 as reflected in conversations on that topic that were posted in public social media. This graph represents just part of the data from a study called Communicating COVID-19 in Post-Quarantine Philippines, a research study conducted by social scientists, public health professionals, media and communication specialists from the University of the Philippines, where one of our main objectives was to develop a research-based communication plan. What is clear here is that there is a mix of emotions: anxiety, empathy, optimism, anger, and boredom. But of all these emotions, anxiety is the most dominant emotion expressed throughout the period. Anxiety is designated by these dark purple colored spikes throughout. Empathy are those that are on the blue shade. Anger is designated by the red shaded areas of the graph. Hope, and I hope you see it, now are down there, little bits of hope and boredom that thread throughout the entire year. These are data collected from February 25, 2020 until the middle of January 2021. Among the main triggers for anxiety were the government's handling, or should I say mishandling, of the pandemic, demands for concrete solutions, particularly for valid information to increase awareness and reduce stress. Fear was also shown in expressions about increasing positive cases, panic buying for food and supplies such as alcohol and toilet paper. Profanities and swear words were addressed at the president and the government for its inconsistencies, its perceived slowness in its COVID-19 responses. Issues about the lack of testing were particularly the target of angry tirades. Look, for example, at this spike here around the month of November. It is the solitary spike of red towards the end of the graph, and that was in November, when there was a typhoon in Cagayan, where people expressed their anger for government's lack of testing kits, which prevented volunteers from answering the call of service to the victims of the typhoon in Cagayan. Fear and anger are manifest also as feelings of loss, the death of a loved one, the loss of a job, closures of businesses, schools, churches, playgrounds, and not being able to socialize, to attend gatherings, or even step out of the house. Our fears and anxieties have taught us to be vigilant about health protocols. So we wear a mask or even double up. We wash our hands regularly. We keep safe physical distancing and even keep windows open when in enclosed spaces. Our anger against the poor pandemic response has resulted in demands to make healthcare a top agenda item for those running in the 2022 elections. But despite these negative feelings, our struggles with COVID-19 awakened our innate ability to empathize and to become compassionate. This is validated in the graph of emotions. Next to anxiety, empathy is the second most dominant emotion. Again, empathy is designated here by the bluish, the light blue areas in the graph. There were calls from private individuals and groups, from companies and networks to support frontliners via donations in cash and in kind, and these were readily heeded by the online public. Bayanihan is a beautiful Filipino term and an even more meaningful response at this time of pandemic. Bayanihan, that Filipino spirit that encapsulates solidarity, cooperation, partnership, and compassion, become manifest as various sectors came together in spontaneous magnanimity to volunteer their services and to provide funds, consumable goods, various health equipment and supplies, innovative solutions, and even quarantine facilities and testing centers. It is no wonder that hope and optimism, although they are not signified as very much in this graph, they are there nonetheless. And we all hope and are optimistic for this pandemic's end. This year's CUPSCon celebrates Bayanihan by highlighting the experiences of COVID-19 public service projects that took a cooperative or whole of society approach. These 2 days of CUPSCon, we will hear each other's experiences. Without a doubt, we will gain much information about how COVID-19 public service undertakings have built the resilience and empowerment of individuals and communities, as well as how to strengthen synergistic public-private partnerships. And perhaps, most importantly, I am sure we will learn much from our extraordinary plenary speakers, Dr. Ga, Patreng, and Dr. Raul, whose contributions to public service have been tremendous before, during, and after this time of pandemic. Again, good morning. Keep well, stay safe, and padayon. Thank you very much.
Thank you very much, VP Pernia, for that uplifting message that surely sets the tone for the CUPSCon 4. At a critical moment in our history, the CUPSCon is set against the backdrop of the pandemic and will thus highlight the initiatives made by higher education institutions and their partners in response to unprecedented challenges. To introduce the keynote speaker for today, it is my pleasure to call on the Director of the UP Padayon Public Service Office, Dr. Jeanette L. Yasol Naval.
Ma'am Jet, video po.
Good morning, everyone. Our keynote speaker for today is a renowned neurosurgeon and is currently the Executive Director and Chief of the Division of Neurosurgery at the Department of Neurosciences at UP Philippine General Hospital. He earned his Bachelor of Science degree in Biology from the University of the Philippines, Diliman cum laude in 1983, and finished his medical education at the University of the Philippines College of Medicine, where he was recognized as an outstanding graduate in clinical clerkship in 1987. Then he completed his neurosurgery training at the neurosurgery section of the UPPGH. He further pursued an international master's degree in neurovascular diseases from the Paris Sud Mahidol University. With 25 years of active practice and teaching in neurosurgery, he has produced several research publications that have greatly contributed to the growing pool of medical research in the country. His most recent publication, entitled Service and Training During the COVID-19 Pandemic, Perspectives from a Neurosurgical Center in the Philippines, was published in World Neurosurgery Journal in 2020. He is recognized for his expertise in skull-based surgery, keyhole and endoscopic surgery, in addressing cases of aneurysm, vestibular schwannoma, and pituitary adenoma. He was a visiting scholar and Grand Rounds guest lecturer at the Barrow Neurological Institute in Arizona, a visiting professor lecturer at the Department of Neurological Surgery at the University of California, San Francisco, and Buffalo General Hospital. He was the first Filipino surgeon to have been invited to lecture at the Harvard Medical System's Brigham Women's Hospital in Boston. Our speaker is a multi-awarded fellow whose distinctions range from being one of the 5 greatest athletes of UP, being the team captain of the UP varsity track and team field during his time, and the winner of Highlands Cross Country Mountain Bike Challenge. He also became a member of the UP College of Medicine Jazz Band, a distinguished alumni awardee, an outstanding teacher in clinical sciences, and was voted People of the Year by People Asia magazine. Under his leadership, UPPGH was designated as the COVID-19 referral hospital for the NCR. And in collaboration with the different units of UP Manila and the UP system, the UPPGH Bayanihan Na Operations Center was launched. Innovations such as the Telecumusta and daily COVID-19 updates and many more were introduced in UPPGH. Even the fire that recently hit UPPGH was no match for his earnest interest to serve. Colleagues and friends in public service, please welcome our keynote speaker for today, Dr. Gerardo Gap Legaspi.
Sorry. Thank you very much for that wonderful introduction. Good morning, VP Elena Pernia and the rest of the organizers and now participants of CUPSCon 4. It is my distinct pleasure to be with you here this morning, and maybe not to educate, not to preach, but just to share our experience as a COVID referral center and the ins and outs that went through it, and maybe learn some lessons from it as we go along. If I may. So this morning, I'd like to just give you just a brief background on what happened in the Philippine General Hospital during its whole time of being a COVID referral center, which may allow me by also alluding to some of the phrases and lines of Rudyard Kipling's poem "If," written before the 1900s, dedicated to his son, who eventually was lost in World War I and never found. And they never found his grave. And I think this is the guide that I use personally to make me see clearly on things that I do with my work, with my life, and maybe even with the COVID crisis that we went through. The Philippine General Hospital is 114 years old now, in a 10-hectare property here in Ermita, Manila. We are one of the biggest public hospitals at 1,500 beds, and before COVID, saw 700,000 patients. Most of them, a lot of them also from all over the country. We are one of the biggest employers of a government office with 4,500 employees, and the biggest trainer training facility with 4,700 trainees. 2 years ago, everything was so peaceful, so light, and that brings me to the song of "Try to Remember That Kind of September." Maybe the more senior of us would remember that, where we had all the stats going on for us. Everything was going up, patient care, our operations, services that were rendered. We were visited by celebrities during our 112th anniversary 2 years ago. We were in the middle of serving the SEA Games in 2019 also with the establishment of PGH Clark. We were building our brain center, and President Concepcion promised that he will build the most beautiful hospital in the country in Diliman, and all plans already starting. We were even poised to report our 100th case in March of 2020. However, when the pandemic blew up early this year, and the country was locked down on March 16, all hell broke loose for us. The chaos that occurred in the emergency room was nothing like we've seen before. The uncertainty of the enemy at hand was also something that we never expected to have in the shores, so to speak, of PGH. And we are all in a quandary, all confused as to what will happen in the next few days or the next week or month, and we didn't expect it to be years. Bringing back to Rudyard Kipling's poem again, as I said earlier, that if you can't keep your head when all about you are losing theirs and blaming it on you, then you probably will make it. And I think the first step that we did then was not to disrupt the flow was not to maintain normalcy, but actually close the hospital. We suspended all elective admissions and asked our employees to report only every 2 weeks. So very unusual and out of our usual processes here in PGH, that we disrupted the services because of the unknown problem that we will all be seeing, and we wanted everyone to be safe. At that time also, amidst all the confusion, there was an attempt to organize the response to COVID. So PGH on March 19 was designated COVID-19 referral hospital to take care of the biggest part of NCR in the southwestern southwestern sector, in addition to what Lung Center and the Jose Rodriguez Hospital will take care of in the northern part. That decision brought in a lot of conflict in the university and even in the hospital as well, and got me to think if I made the right decision in agreeing to make the PGH a COVID referral center. And I think it was just a matter of explaining to people, making them understand the purpose of what we were going into, and making them part of it in an inclusive way, and telling them that it was the right thing to do. And after explaining that to people in PGH and the alumni, I think the acceptance and the cooperation followed clearly thereafter. The first step was to create a crisis management team composed of hard-working and tested in battle surgeons who had their own ways of doing things, and as I always tell people, ready to break rules to do things. But we're all guided by science, by our hospital infection control unit head, Dr. Lina Berba. So although the processes went fast and furious, so to speak, they're all guided by the reason of science as mandated in our processes. We also formed an information and education committee, which is key to maintaining communications with everyone inside and outside of the hospital, which proved to be very useful in making sure that everyone knew what the plan was and everyone knew the directions that we were going. Major infrastructure changes had to be made because PGH is an old structure, and air circulation had to be improved, employing ventilation techniques that allowed us to decrease the likelihood of transmission in the COVID wards. So from a scenario like this in the emergency room, we had to empty it and make sure that the healthcare workers and the patients as well were safe during their stay there. So with the help of our engineers from UP Diliman, private architects and engineers also, we were able to make a flow into the wards, into the 100-year-old wards of PGH, unidirectional, so that air exchange is ensured and that the virus in the air is driven out of the ward at a constant rate. We promised DOH 120 beds of COVID, but we actually prepared 243 just to be sure if in case there's a surge afterwards, and then indeed there was. I think one of the most one of the most emotional time during the whole process of preparing for COVID was the day before we opened, when our COVID operations head, Dr. Boc Ocampo, started the orientation for our staff, the doctors, the nurses, and the other support staff. And you could see in the eyes of these young men and women the fear and the uncertainty, but at the same time, the commitment to do what needed to be done without hesitation and with a lot of preparation also. So on March 30, 2020, PGH formally opened as COVID-19 Referral Center. The hospital is mainly dependent not only on technology, on income, on resources, on financial resources, but is dependent on a lot of men who counted on the administration for them to be supported and helped. And of course, after all the preparations were done, making sure that all safety measures were put in place for our healthcare workers, we went off to war. And as a leader, I went off to war with them as well. I think it's important for us to show our soldiers, so to speak, that we fight the battle with them in the front lines. And in an unknown enemy situation, we can only add to the bravery of these healthcare workers by being with them ourselves in the front lines. So we also have to be there with them, and we celebrate when we achieve minor victories, which propels them to do even better and even be more committed, knowing that their sorrows are our sorrows, their victories are our victories as well. So the COVID-19 Referral Center experience has made us realize more and more that our most valuable resource is human resource. We had to help manage their fear, we kept them informed. Of course, we kept them protected and comfortable, and they became partners rather than just mere soldiers at the beginning of a war, and they became our source of pride and inspiration. But of course, all of this we can do from our end, but we can never do it alone. This is where our partners came. We were in that line in the poem of Rudyard Kipling. We were able to, so to speak, walk with kings, with the biggest, with the richest patrons from all strata of our country, our society, and even the common man on the street were ready. They're all ready to help PGH navigate through the COVID-19 crisis. So going through this common men and the kings. I would say there are more than 300 groups that really fought the battle with us, involving thousands of individuals and maybe a rough estimate of more than 2 billion pesos spent in the last one and a half years. Of course, people came from big business. The first one to respond to our pleas were, of course, the UP system, NGOs, organizations of students and other civil societies, other universities, other schools, or government agencies like the Department of Health, other private hospitals like St. Luke's Medical Center came first with their donations. Private individuals and lots of them, a lot of them anonymous. We had a few celebrities and diplomats as well. Just a small story on the big business. One time, I was while in my office, I got a call from on my cell phone on an unknown number, and when I answered it and asked who it was, on the other end, the individual said, "This is Manny," and I said, "Manny who?" "This is Mr. Manny Pangilinan." So I was so surprised, no? When he called me directly, just to assure me that his company and his hospitals are behind PGH in this fight. So in harboring all of these partners, I think we have to know the roles that they will play, and I think that's very essential highly essential in a successful campaign such as what was done in PGH. The early involvement of UP in the crisis, the administration most especially allowed us to ask for more money from DBM even before the operation started. So the quick thinking of President Concepcion gave us hundreds of millions of pesos to start with, or otherwise we would have sunk into negative balance because of the high cost of COVID care for patients admitted to PGH. We also very well know the importance of the laboratory that was established at the UP NIH in UP Manila, and the test kit developed by Dr. Destura, all under the auspices of our Chancellor, Dr. Carmencita Badilla. So we were never left alone in our battle in the UP system, where the hospital probably is the laboratory for the students and other workers involved in the University Health Sciences Center. UP Manila became a constant partner as well when Chancellor Padilla, seeing that you're not only having problems dealing with the COVID concerns, clinical concerns, but also dealing with the voluminous number of donors that we had to talk to every day. The President and Chancellor Padilla established the Bayanihan call center, which is the operations of donation, and I would say by the hundreds of millions to the PGH, making it more efficient and maybe more convenient for our donors as well, which encourage more donation, of course, in the future. UP Diliman did not fall behind by offering its engineering units in both in the infrastructure and later on in our online telemedicine program, both from the engineering department, including industrial engineering. UP Visayas from afar sent their own manufactured face shields. And in the early days when face shields cost a lot, as we know from current happenings in the Senate, it was a big help that UP Visayas sent us thousands of face shields, saving us money also along the way. This is the call center that was put up, 155-200, for not only for COVID cares, COVID concerns, but also for donations. And the donation is still ongoing up to now. The COVID Bayanihan na Center was manned initially by interns and now by interns and nurses, continuously offering advice and also paving the way for consultations in PGH. At a certain point, the donations and dormitories, we estimated probably was at around 2 million pesos a day, because at a certain time, 15 hotels, 10 schools, and religious dormitories were needed to house 1,800 healthcare workers who couldn't go home because of the lack of transportation. So there's a huge manpower management done by Dr. Rodi Dofitas, and our goal was to keep them safe, and of course keep them coming to the hospital when needed by the services. A challenge also, of course, was the transportation, which was all during the lockdown, and donations from various motor companies, motor cooperatives, drivers cooperatives really came in very handy. And in addition to that, nearby employees who live nearby started doing bicycle rides to and from their homes, all donated by individual organizations and individual persons as well. We estimated that 90% of our bicycle users were first-time bicycle users during the start of the pandemic. Up to now, there are more than 300 bicycles being used around in the bicycle program of PGH. And of course, we could not do anything. We could not start the program without having enough PPEs. These were gold. These were like gold at the start of the pandemic, where we are always in competition with other institutions to get the best PPEs in the most number that we can, ensuring our healthcare workers that we have enough for 1.5 months at any given time. So the controversy behind the PPEs was born out of the fact that we all institutions had the urgency to protect their healthcare workers also. Not only PPEs, but also common appliances were afforded to us by our donors. I remember one donor who had the factory of an electric fan or exhaust fan brand opened so that we could get our ventilation system constructed and going and open the COVID ward. So washing machines were donated, TV sets were donated, all in the hope of making the lives of our healthcare workers better also. St. Luke's Medical Center was the first one to donate motorized beds so that ease of our care for our COVID patients is improved. No? So imagine a healthcare worker in complete PPE, sweating inside, cannot go to the toilet unless in 4 or 8 hours, having to move patients. Now with motorized beds, they're able to take care of the patients better by changing positions and the height of the bed as well. So this came in very handy, very much in tune with the need of the hospital. Tents were also donated to allow us to expand patient areas and healthcare worker areas outside of the wards that were already filled up to the brim because of distancing. One of the offshoot of our operations is the establishment of our digital technology system. Wherein we were able, one of our officials with a computer science master's degree actually made an electronic medical record system for the COVID ward, which now extended to the whole hospital. And in addition to that, during the time that we were about ready to open our outpatient department online, the Department of Industrial Engineering, in 1 month's time, put together 12 of their faculty to come up with our online consultation and registration system in the outpatient department, making the access to our services, outpatient services, available even during the lockdown. Ideas like an online kumustahan with patients really came in very handy and were highly appreciated by patients and often brought tearful reunions and and conversations between patients and their relatives, and even the social workers at times. We were recipients of swabbing and sanitation pods that were being developed continuously by DOST and our UP CBOL, the innovations group of the UP College of Medicine. On private on their private capacity, companies develop devices, including this mask, that help us deliver oxygen to patients without by modifying the airflow and improving the entry of oxygen to their lungs. So at the same time, being a surgeon, I was given a special mask that I could use during surgery, and I could breathe filtered air comfortably into my mask and breathe it out also without fogging the lens, protecting me from any COVID patient during surgery. So there were also numerous projects in conjunction with DTI, the Department of Health, Bureau of Board of Investments, and the private group of Confederation of Wearable Exporters of the Philippines, which developed the local PPE, which up to now we are using here in PGH. Of course, just there's an operation like the COVID crisis battle will not be complete with the adequate nutrition and the occasional treats from our donors. So I think this is a letter from Liza Soberano when she sent pastries, and cake companies will send us special cakes just to celebrate landmark moments in our fight against COVID. We were very touched by gestures of individuals who hand-sewed PPEs for us and masks to be used. And I think one of the biggest donors of our coffers through the Philippine General Hospital Medical Foundation was TikTok Philippines, who donated, which donated $1 million. And thankfully, they did not ask me to do the TikTok dance, and I was really appreciable, and I really appreciated that. The other needs that we had to have partners with, of course, were the intangible ones, the ones that we did not see on the surface, ones that improve the well-being and the mental wellness of our healthcare workers. And I'd like to make special mention of the commitment and the devotion of our chaplaincy, headed by Father Lito Ocon, who donned PPEs as early as April to be with dying patients, to be with lonely patients, to be with desperate patients, and give them a spiritual experience while suffering inside the COVID wards. So I think this all contributed to a holistic approach to the COVID crisis, not only for our healthcare, for our patients, but for our healthcare workers as well. So why did we get all of this from donors? Why did people want to partner with us? Why did they want to part with their funds and give a lot of it to us? I think anyone who would like to establish a partnership should be able to offer a glimpse of hope in a situation like the COVID crisis. I think at that time, when it was very chaotic and there was no clear plan on what was going to be done, maybe the Philippine General Hospital offered a glimmer of hope of some organization or some scientific reasoning for what was being done, and maybe just the fact that healthcare workers continued to work and report and work inside the hospital gave people a semblance that things will be all right, and they were willing to support that feeling of hope, transforming their lives as well in the process. And I think in order to sustain that partnership, we have to really cultivate trust. We cannot in any way compromise the ideals that we were that guided what we did in the hospital, because trust is what brings forth continued partnership and continuous relationships with our benefactors. Up to now, the same partners heed our call every time there's a need to upscale operations in PGH. So hope and trust are key. And I think one of the most liberating moments also during our time as a COVID referral center was after we have established the fort, so to speak, of PGH. We reached out to where actually the war was being waged in the community. No? I always say that PGH is just like a field hospital. We take care of the wounded and the dying in the war, but the actual war was fought in the community. So we reached out to the city of Manila, which offered in return assistance to PGH by offering security. You know? In the early days of the pandemic, even our healthcare workers were harassed for working in a COVID referral center in the streets around here in Padre Faura, in Pedro Hill. No? And not 10 minutes will pass after calling the city of Manila that the police car will come in and save, so to speak, our healthcare workers from this harassment. So in return, we participated in building a community quarantine for the city of Manila. We also reached out to train swabbers in other hospitals. We supported the health service in Diliman so that they'll be better protected and can serve, and did the tests for them of the Diliman community. The COVID referral center of Manila was Santa Ana Hospital, and we provided additional manpower and PPE, and of course the whatever technology and clinical know-how we can. In the first few seafarers who came back to Manila, PGH volunteered to have them tested so that they can go back to Iloilo after months or years of being away from their families. So I think helping out or reaching out to others helps us, help ourselves also. So as after all of this, still PGH is a university hospital. Its mandate of service, training, and research to continue. And even in the most difficult times, when we have served what we could as a COVID referral center, we still have to do bigger things, I think, in the future, and we have to hold on to whatever we have learned here in the current crisis. So as we move along, still preparing for surges, and we have 4 so far, and at the peak of the surge last August, we reached 325, more than 100 beds of almost 100 beds more than what we have prepared. Now, so you can imagine all the stresses it caused into the already borderline crashing system of the healthcare. So fortunately, we're able to weather that, and now we're down to 171, still more than most hospitals, but already for us a very comfortable level. So while traversing to all of this, we had to do our vaccination drive, and in the middle of all of that, there was a fire that broke out in PGH. Meron nga kasabihan sa Tagalog na mabuti ng pwede nang manakawan, wag lang masunugan. At ang PGH po, nanakawan na ng COVID, nasunugan pa noong May 16, 2021. No? So, but as I said, to all of it, our donors and our benefactors, and of course, everyone that helped PGH in the past continued to help it. So as we move on forward, every day that passes, every minute that elapses, we continue to fill it with activities, not only to serve our patients, but also to educate our students, and of course to further research in healthcare. And once you have done all of that, I think, as Rudyard Kipling once said, maybe we ourselves soon will be men, as Kipling has described them to be. So one of the most affected by this crisis are the trainees of PGH. And these are dermatologists, pediatricians, surgeons who have lost the opportunity to be educated in their chosen specialty. But in one of my discussions with them, I told them that we too, almost 40 years ago, faced the same uncertainty when our education was disrupted by the revolution that occurred in EDSA. And as we stood in the sandbags in 1986, we did not know what was going to happen after that. But right where we are where we are now, and as I always believe, we are where we are meant to be. And I told them that maybe the pandemic of 2020 puts them in the same situation, that the education that they got from all of this is much more than probably the training that they would have gotten the same time, during the time that they were serving as some other doctor during the pandemic. And I think the biggest bragging right that my trainees, that these trainees will have, as I did in 1986, is to say that I was there. So as we roll on to do to plan our lives ahead of COVID and not behind it anymore, I think the importance of being able to work with everybody else comes into play, and it is really the main theme of this convention. So before I end, I'd just like to, for the first time, I think this is the first time I'm doing it in public, to give to thank the UP Crisis Management team for all the work that they have done through the months that we have been a COVID referral center. This is a mixture of different kinds of doctors and the staff that support them as well. So these are the people who whose motto has been the difficult we do immediately, the impossible will take a little longer. So to everyone, good luck with the convention, and thank you very much for giving us time to share our story with you. Thank you.
Thank you very much for your keynote speech, Director Gap Legaspi. Your resolute leadership in the Philippine General Hospital and commitment to rally everyone together to give care, especially when the COVID-19 pandemic broke out, surely gives everyone a glimpse of a silver lining in this difficult situation. Until now, we receive in our Facebook page at fb.com/UP Public Service inquiries about teleconsultations, COVID-19 testing, and referrals to the PGH. The effective information dissemination of PGH in their Facebook page and Viber and Telegram groups actually help us in relaying relevant information. We will now take this time to award the Certificate of Appreciation to Director Gap Legaspi. The UP Padayon Public Service Office, Office of the Vice President for Public Affairs of the University of the Philippines, awards the Certificate of Appreciation to Gerardo B. Legaspi as our keynote speaker for sharing his invaluable experience and expertise in his phenomenal leadership as the Executive Director of UP-PGH in addressing the challenges of COVID-19 and in inspiring the delivery of public service at the time of a global pandemic. Given this 21st day of October 2021, during the fourth colleges and universities Public Service Conference. Signed, Elena E. Pernia, PhD, Vice President for Public Affairs of the UP System, and Dr. Jeanette Eliasol Naval, Director of the UP Padayon Public Service Office. Next slide. Thank you, Director Legaspi, for gracing the CUPSCon 4 and inspiring us to spur on with a commitment to do public service. Now, to proceed with the conference orientation, may I call on once again the Director of the UP Padayon Public Service Office, Dr. Jeanette L. Yasol Naval.
Thank you very much, Doc Gap, again for sharing with us all the hard work of the healthcare workers and the experts, your partners, the team who worked with you at the UPPGH. It was truly a very inspiring and heartfelt experience of selfless public service. Good morning again, everyone. On behalf of UP Padayon, I also would like to welcome all of you to the 4th Colleges and Universities Public Service Conference, or CUPSCon 4. The inception of the first CUPSCon in 2015 started a groundbreaking tradition of holding a public service conference that highlights the significance of doing public service. State universities and colleges and other higher educational institutions were convened so that best practices in the delivery of public service and opportunities for engagements may be shared. It also took off to tackle the challenges and the future direction of public service in higher education. What started as a humble undertaking, which facilitated the coming together of public service practitioners and institutions working to address the society's changing needs, CUPSCon now prides itself in having been conferred the Silver Anvil Award in the 56th Anvil Awards of the Public Relations Society of the Philippines. Public service has never been more necessary than in the last 18-20 months of this global health crisis. And our higher education institutions have proven their integral roles in its delivery amidst the pandemic. On its 4th installment, CUPSCon takes the theme Public Service in Time of COVID, the role of academic community partnership in addressing the challenges of a global pandemic. This year's conference seeks to present excellent, invaluable, and magnanimous public service initiatives that were undertaken to deal with the impact of the pandemic. A total of 104 papers will be presented in 24 panel sessions that tackle direct pandemic response initiatives, mental health, disaster risk response management, and other technical assistance as public service, education and innovations that help capacitate special sectors, alternative approaches in teaching and learning, and public service projects that are oriented towards adapting to the new normal. These papers represent a diversity of projects and initiatives implemented across all the different regions of the country, including those that were undertaken by a network of alumni in Finland, Australia, and the United States. Well, this pandemic has affected us all, everyone, including our public service practitioners. But those who were called to serve, big or small, through their expertise and research, provision of volunteer service, technical assistance, local government support, or by institutionalizing community programs, have extended their hands and selfless compassion for others. CUPSCon 4 is privileged to have some of these pillars who have been instrumental in addressing the challenges of the pandemic. Dr. Gerardo Legaspi, who is the Executive Director of UPPGH, the institution which is at the forefront of delivering the country's pandemic response, has given us the keynote speech. 3 distinguished plenary speakers will also grace our conference. Dr. Raul Destura, who developed the Gen Amplify COVID-19 RT-PCR detection kit during the early phase of this pandemic, Ms. Patricia Noon, who introduced and inspired all of us in building community pantries, and the Honorable Marcelino Chodoro, who was staunch in his COVID management policies and initiatives in his own local government unit. It was indeed very challenging for the team to work and stage this conference in a totally different platform. But I would say we have seized Zoom and the OBS, and so we are on live stream. May this 2-day virtual conference serve to inspire the continuous conduct of relevant public service for our communities, our people, and the nation as we continue to remain steadfast in our yearning to serve. Padayon and enjoy the conference.
Thank you very much, Director Jet. Before we proceed to the break and the parallel sessions, we would like to direct your attention once again to the conference's house rules. Kindly observe proper video conference etiquette. Please put your microphones on mute at all times and open it only when you will be presenting or when you are instructed to do so. The links to the plenary and panel session rooms may be accessed at bit.ly/CUPSCon links. Please note that registration for the plenary sessions is required and should only happen once. On the other hand, registration for the panel session rooms is not required for the participants' convenience. However, for the issuance of certificates, we are asking participants to advise their guests to register for the webinar at bit.ly/CUPSCon links before proceeding to the panel session rooms. Please direct your inquiries to the members of the conference secretariat. We will be sharing photos of the conference in our social media pages with the names of the participants blocked out. To maintain the privacy of your fellow participants, please exercise caution in taking screenshots of the panel sessions. Copies of the presentations and recordings will be distributed after the conference upon request. Most importantly, please listen to the presentations and participate well in the discussions during the open forum. See you in the plenary session again this afternoon.